I think that it should be made legal personally.
I think it should be made legal.
I think it should.
I think it should absolutely be made legal because
I would define it as a case where someone needs help in ending their life.
if a person is in a lot of pain or there's absolutely no way that they can recover, a physician can end their suffering.
It's definitely something that's in controversy at the moment. People are debating whether it should be legal, whether it should be illegal, and there's definitely a huge debate regarding ethics and sort of two sides of the story.
Battle has come to a disappointing end for Sue Rodriguez. The woman from British Columbia has lost her court fight for the right to have a doctor help her kill herself. The Supreme Court of Canada has ruled against her request for a doctor-assisted suicide.
Rodriguez is slowly dying of ALS, or Lou Gehrig's disease. It has left her barely able to speak, to swallow, even to breathe.
At her news conference, her voice barely audible, she expressed her disappointment. She thanked Canadians for supporting her and urged Parliament to act.
I hope that Parliament will act and allow those who are in my situation to benefit in the future. Whose body is this? Who owns my life?
I think that there are many instances in which assisted suicide should be made legal, and that comes from my experience working with palliative patients over the years as a registered nurse. I've had patients that would go to bed every night wishing they wouldn't wake up in the morning, and family members who agreed. The amount of excruciating pain that they were in, we were just, it was impossible to manage it. And I think their wishes should have been considered so that they didn't have to suffer anymore.
I think there has to be a legal binding that renders it case dependent, because there's certain scenarios where physician-assisted suicide is a predicament, but then there's also the other side where it could end up being a danger to the patients.
This is being practiced elsewhere, and I think you may have, well, and it's already started in Quebec. Quebec's come up with legislation. Now it varies, but I think it would be nice for the legislators to come up with a uniform set of laws that would apply across the country.
In many ways, I think that I've also been involved in situations where we did assist the person to pass. I guess a form of assisted suicide where the pain was just increasing so much that we would, with doctor's orders, slowly administer more and more morphine or more Dilaudid, and the person would just become more sedated and unresponsive, and ultimately their breathing slows down and they pass.
I would like the legislators to come up with a uniform set of guidelines. I'd like the Canadian Medical Association to be involved in terms of setting guidelines. And I think it would probably be a good idea for physicians who are interested in taking part in this to be certified. That
A lot of people are terminally ill and just don't have much living left to do, and they're forced to just like wait out the pain.
I definitely have been in situations where I wished it was legal, and not because I wanted to be able to actively assist the person to pass, because they were asking. And you know, to have somebody saying, make this pain end, how much longer? Can it just be over now? I don't want my family to see me like this. This isn't me, this isn't who I am. And to have family crying and asking on a daily, hourly basis how much longer, we can't watch them do this anymore. It's really tough as a healthcare provider to watch that.
The pros of assisted suicide would be that people are able to make their own decisions about their lives, and that it can prevent a lot of unnecessary suffering for people.
It's basically allowing someone to die with dignity.
Vital organs can be used from the individuals and given to the patients in need.
This is allowing someone to die with dignity rather than just a body and a little bit of who they used to be.
suicide and attempted suicide are legal in this country, but aiding and abetting suicide and attempted suicide are illegal. So, the way I think, why is aiding and abetting a legal act illegal?
I think that the legalization of assisted suicide is important because it gives the right to people to die with dignity.
Teens who experience certain mental health conditions may have suicidal thoughts, and if this is rendered legal, in all scenarios, that could lead to some dramatic decisions, but there's nothing we can do about it because it's a legal situation. Whereas if someone is slowly dying and they know that they are terminal, I do believe that there should be a predicament where they can use physician-assisted suicide.
Mental evaluation would be important to rule out things like anxiety, depression, mental illness.
I was at a presentation with him and someone asked that question, what about someone who's severely depressed? And his answer was, provided they'd used up all their options, including medications and ECT and all of that, then personally, he had no difficulties with it. I might be a little different there. If it's depression, then the person obviously has the physical means to end their own life and may not require the assistance of a physician in that instance. And
since suicide is legal, why do we perceive physician-assisted suicide as being so wrong?
I don't tell people how to run their lives, and I think I should have the freedom of choice at the end of my life.